The 1918 flu pandemic was one of the deadliest pandemics of the 20th century. Around 500 million people around the world were infected, with around 700,000 cases in the United States. Of these, there were an estimated 50 to 100 million deaths, with about 500,000 dead in the United States. Mortality was high in infants and people aged over 65. What made this flu unique was it also had high mortality rate in young and healthy people aged between 20 to 40. That brings us to the question we are seeking to answer today. How did the 1918 flu pandemic change the lives and habits of the American people? There were many countermeasures taken to combat the virus and change how Americans live their lives, including the use of disinfectants, practicing good hygiene, placing limits on public gatherings, and enforcing quarantine and isolation. The pandemic also pushed many people into the medical field and persuaded Americans to become nurses, pushing people into a profession they might have otherwise not been interested in. These nurses would play a pivotal role in helping victims as home visits became common practices. We will begin by taking a look at how the medical field was affected during the pandemic. During the pandemic, the United States was facing the First World War, and there was a lack of medical personnel as they had been drafted into military service. People with medical training were called on to volunteer their services. Nurses were now in high demand. Here we see an advertisement that shows training was offered at the Chicago School of Nursing. It was enticing possible nurses by telling them that there were many opportunities for advancement and great pay. Nurses were scarce as the demand for them rose. As cases continued to rise, the Red Cross put out desperate calls for trained and untrained volunteers to help at emergency medical centers. We will now be looking at a more specific case in Pennsylvania. Nurses making home visits was becoming a more common practice. The Visiting Nurse Society of Philadelphia provided home visits to care for patients of influenza. The nurses would often see 20 to 30 patients per day, with many calls being for an entire family. There were many times where they would unfortunately arrive too late, with patients having died hours before they arrived and children being left orphans. In this case, we see a nurse visiting an entire family that had been ill with the exception of a little girl. She took the time to care for the sick and their baby and made sure they had a fire going and food prepared, as well as neighbors to check in on them. It is likely this family would have died had they not been helped by this selfless nurse putting herself on the line. The 1918 flu affected more than just the nursing field. Many cities began to take initiative to combat the virus. In Philadelphia, a campaign was launched against spitting, sneezing, and coughing in public. As there were more and more confirmed cases of the flu in the city, public spaces such as schools and churches and theaters began to shut down, with victims being quarantined in their houses. San Francisco and California mandated that large gatherings should be open air and outdoors to prevent the spread of the virus. Citizens were advised to avoid public services such as buses during rush hours and to avoid crowds. As seen in this PSA, people were encouraged to keep their windows open, a practice that became widespread across the nation. This was also done to help stop the spread of the flu in enclosed spaces. Despite the press initially dismissing the virus in order to keep focus on the war, bodies began to pile up, and Americans began to fear coming in contact with other people. New Haven, Connecticut resident Joe Delano recalled that normally sick neighbors would help each other out, but upon being hit with the pandemic, no one would go out to help. Goldsboro, North Carolina resident Dan Tonkel recalled that people would be afraid to even breathe and leave their homes. From Washington, D.C., William Sardo said that people would have no social life as any sense of community was destroyed. Fear had become so prevalent that streets across the United States that were normally busy would be empty, with cars becoming a rare sight. Let us take a look at the story of survivor Annie Laurie Williams. Annie was from Selma, Alabama, and her father had become ill with influenza. Her mother had become his primary caretaker. Neighbors would leave food at her home's doorstep but would refuse to come in. She recalls businesses being closed because there were not enough personnel and people were too afraid to go into town. Annie's story is similar to what many Americans, businesses, and towns were facing during this pandemic. As we are seeing today during our own pandemic, mask-wearing ordinances had been issued, although it was mainly across western states. Cincinnati, Ohio, for example, urged people to wear masks to stop the spread of influenza. Because the nation was also facing the First World War, wearing masks was framed as a way to help protect soldiers from the deadly outbreak. Many people complied with the new ordinances as they saw it as a patriotic thing to do. There had even been a PSA issued by the Red Cross that called people who would not wear masks dangerous slackers. In this photo, we see women making masks to combat influenza at a location that was hard hit. At the time, there had actually been a debate on whether or not the masks were actually effective in helping against influenza, as surgical masks were not as effective as they are today. Some places were more relaxed on what was considered a face covering, and fashionable masks were made in order to get people to wear them, but the materials these were made from were usually not effective. Many people complained about the masks being uncomfortable, and some people poked smoking holes in them or went without them entirely. Although there was a struggle to enforce masks among these people, they would often face fines, jail time, and got their names printed in the paper. Another way Americans changed to fight the pandemic was by turning to home remedies and pharmaceuticals. Newspapers were printing various remedies that were believed to help fight influenza. Many drugs were prescribed by physicians to help combat influenza that included heroin, codeine, cocaine, opium, and morphine. These were sold in small doses due to the potential hazards and risks associated with them. Many remedies for influenza also contained large percentages of alcohol. This brings us back to our initial question. How did American lives and habits change due to the 1918 influenza pandemic? After looking at different photos and primary sources, we have seen that many measures were taken that affected everyday lives of people. There were mask mandates put into place. Quarantine and isolation became common as streets emptied, people left windows open and gathered in open-air places. Fear caused people to distance themselves from one another and not want to go out of their way to help sick neighbors. Yet, this also brought about a patriotic surge in nurses as more and more nurses were required to meet the needs of people suffering from influenza. Nurses made home visits become a common thing as they helped to save lives and became heroes in the eyes of many.